Did you know that before 1965, nearly half of all senior citizens in America had zero health insurance? Imagine that. You work your whole life, you retire, and when you need healthcare the most, there's nothing there. No safety net, no plan. That crisis is exactly what led to the creation of Medicare. And over the past 60 years, it has evolved from a basic hospital insurance program into something that now covers dental, vision, hearing, groceries, and even gives you a prepaid flex card, all at $0 a month in premium. This is the story of Medicare. Let's go back to the 1940s and 50s. World War II had just ended. America was booming. New cars, new homes. The American dream was alive and well. But there was a massive problem hiding in plain sight. Healthcare was a luxury. If you were lucky enough to have a job with benefits, you were covered. But the moment you retired, that coverage vanished. Seniors were the most vulnerable population in the country and the least insured. President Truman actually proposed national health insurance back in 1945, but it was blocked. Critics called it socialized medicine. For nearly 20 years, the idea went nowhere, while millions of seniors went without care. Then came 1964. Lyndon Baines Johnson won the presidency in a landslide, and he made health care for seniors a top priority. On July 30th, 1965, in Independence, Missouri, President Johnson signed the Social Security amendments into law, and standing right beside him, former President Harry Truman, the man who first dreamed of this 20 years earlier. Truman became the very first person enrolled in Medicare. It was a powerful moment. Medicare launched with two parts. Part A covered hospital insurance, inpatient stays, skilled nursing, and hospice. Most Americans qualified automatically through their payroll taxes. No extra premium. Part B covered medical insurance, doctor visits, outpatient services, and lab work. This one required a monthly premium, but it was affordable, and it was optional. Together, Parts A and B became what we now call Original Medicare. And overnight, millions of seniors finally had access to health care. But here's the thing. Original Medicare was never designed to cover everything. Part B only paid 80% of approved costs. There was no cap on out-of-pocket spending, and there was zero coverage for prescription drugs, dental, vision, or hearing. Seniors quickly realized they still faced major financial exposure. A single hospital stay could wipe out a lifetime of savings, even with Medicare. So the private insurance market stepped in with what became known as Medigap plans, also called Medicare Supplement plans. These standardized policies filled the gaps in Original Medicare. Plans like Plan F, Plan G, and Plan N became household names for retirees. Medigap was a good solution, but you had to pay an extra premium for it, and you still had no drug coverage. For decades, prescription drugs were the biggest hole in Medicare. Seniors were paying full price at the pharmacy, sometimes hundreds, even thousands of dollars a month, out of their own pocket. Finally, in 2003, Congress passed the Medicare Modernization Act. And in 2006, Part D officially launched, Medicare's prescription drug benefit. For the first time, seniors could enroll in a drug plan that significantly reduced their pharmacy costs. Part D plans were offered by private insurers, each with their own list of covered medications called a formulary. It wasn't perfect. There was a coverage gap known as the donut hole, but it was a massive step forward. And in 2025, a brand new $2,000 annual cap on out-of-pocket drug costs took effect, essentially closing that gap for good. Now, here's where things really get interesting. Back in the 1970s and 80s, the government started experimenting with a new idea. What if private insurance companies could offer Medicare benefits, and maybe do it better, or at least differently, than the government? This led to Medicare Plus Choice in 1997, which eventually became what we now know as Medicare Advantage, or Part C. Early Medicare Advantage plans were mostly HMOs, health maintenance organizations. They were affordable, but they locked you into a small network of doctors. Not everyone loved that. But over time, PPO plans entered the market. Then special needs plans for people with chronic conditions. The options kept expanding. And then, something remarkable happened. Medicare Advantage plans started including benefits that original Medicare never covered. Dental care, vision exams, hearing aids, fitness programs like silver sneakers, over-the-counter allowances, and many of these plans were available at $0 in additional monthly premium. The enrollment numbers tell the story. In 2005, only about 13% of Medicare beneficiaries were on Advantage plans. Today, over half of all Medicare-eligible Americans choose Medicare Advantage. That's more than 33 million people. So let's talk about where Medicare stands right now, in 2026. Today's Medicare Advantage plans are, honestly, incredible compared to what existed even 10 years ago. We're talking about plans